Good morning, everyone. I'm Sharon King. I joined the National MPS Society as COO in June, and I'm excited to be with you this morning for my first family conference. I'm particularly excited to see you this morning to talk about our role as rare disease advocates. Each of us can make a difference, and our voice is one of the most important tools in our toolbox. And that's why it's such a pleasure to introduce three exceptional advocates to you this morning to hear their thoughts on what's next for rare disease advocacy and policy. Each of them came to advocacy in a little different way. Annie, through the power of a friendship in her youth, Amy, from her professional experiences and perspectives, and Stephanie in a very personal way as a mom. We can all be exceptional advocates, and it's important now more than ever. I'm looking forward to the ideas that Annie, Amy, and Stephanie will share with us this morning. I'm going to introduce all three of them and then let them come up to the podium to share their thoughts with you. Annie Kennedy is Chief of Policy, Advocacy, and Patient Engagement at the Every Life Foundation for Rare Diseases. Her focus is on improving health outcomes for people living with rare diseases by advancing the development of treatments and diagnostic opportunities for rare disease patients through science-driven public policy. Annie's work includes building strong partnerships with policymakers, federal agencies, industry, and alliances. Amy Gaviglio is a certified genetic counselor and founder of Kinetics Consulting, which provides public health genetics, genomics, and rare disease services across the country. She's been working in the newborn screening and rare disease space for the past 16 years, and her current efforts include the Centers for Disease Control and Prevention's Newborn Screening and Molecular Biology branch and the Association of Public Health Laboratories. Amy is also a member of the National MPS Society's Scientific Advisory Board. And Stephanie Cozine serves as a board secretary at the National MPS Society and is mother to Ethan and Claire. Ethan was diagnosed with MPS 1 in 2016 at the age of 9 months and received a life-saving bone marrow transplant at 11 months of age. Stephanie joined the Society's Board of Directors in 2020 and has served in numerous capacities, including chair of the Education, Communication, and Advocacy Committees. Stephanie has a passion for newborn screening, empowering youth advocates, and expanding treatment across patients and their families and access for patients and families. I want to thank each of them for being with us today, and I'll invite Annie to come to the podium.
So quiet in this room. Good morning, everybody. Thank you so much for having me here today. It's really an honor to be here with you again. I believe I was able to join you last year, and it was really a delight to be here then as well. So I've been asked to talk about the power of advocacy, and you'll see some of your community members in this image. We are the Every Life Foundation for Rare Diseases, and we serve as a platform for the broader rare disease community to come together around shared priorities. We are policy, advocacy, and patient engagement community. Our advocacy falls under a number of different areas of opportunity for the community, and these are just a few. If you're new to us, we encourage you to look into some of these opportunities, especially if you're individual organizations in the room that might be interested in grant opportunities that we may have available for you. If you've never come to Rare Disease Week, or right now we're hosting Rare Cross America, which are in-district lobby days. But we have lots of opportunities to connect with elected officials in state or in Washington or in your backyards to ensure that your priorities are known by those who've been elected to represent us. So that's what our advocacy program is intended to do. And then our policy program is where we bring together the rare disease community, which includes lots of diverse stakeholders. So patient advocacy organization leaders, biopharmaceutical leaders, academics, clinicians, other coalitions, around our core pillars, which are diagnostics and newborn screening, public policy, regulatory policy. So that's developing infrastructure to ensure that we close that gap for those who are awaiting efficacious therapies, and access and value. And together we identify what are the challenges and where are the opportunities to drive legislation and policy forward. And so I'm going to spend most of today talking about those policy opportunities, and then advocacy is the way that we do it together. Okay, so why are we all here? I assume some of you know this really well, but this is a good refresher, especially in this environment. The term I like to use for really the world that we're living in right now is dynamic. It's kind of a nice way to say that we feel like we're in the spin cycle sometimes of a washing machine. It's a very dynamic environment that we're in. But the truth is we're a part of an ecosystem. And we've been hearing today, I've been really enjoying the presentations today from representatives from this ecosystem. There are so many stakeholders and so many players that we as patient communities need to be engaging with and need to ensure understand the priorities of our community. And these are just some examples of those stakeholders in our ecosystem. And all along, we have data, we have experiences that we have to bring to bear to those stakeholders in the ecosystem. About 7 years ago, a little over 6 years ago, at the Everyday Foundation, we realized there just wasn't a lot of really good data to inform the decisions that were being made by those different stakeholder groups in the ecosystem. So one of the things that we set out to do was to work with the broader community to move from those back of the envelope assumptions around what the lived experience of rare disease was to some real hard data around that lived experience broadly across rare. And so this is some of that data that we together as a community have gathered, and you have hopefully participated in some of these efforts if you've taken some of those surveys that the MPS Society has helped us develop and then disseminate. But this is some of what we now know about rare disease. We know that there are an estimated more than 30 million Americans living with rare diseases. That means that collectively we make up more than 10% of the US population. We also know that that's a gross underestimate because we know that it's very hard to count because many of us don't have some of those codes that are required to be able to count us in the healthcare system. We also know that the impact of living with a rare disease, and this is going to sound like a duh, aha to everyone in this room, is staggering. But what's really important about us having health economic data around rare disease is that's fine for you and I to know that because we have family members living with rare diseases. But what's really necessary is for policymakers to understand that. And it's really important for us to have that data and be able to break down that it's not just the direct costs, those healthcare costs that are driving costs, but it's also the out-of-pocket costs. The costs, the number of times that a provider writes a prescription and you walk out of their office and then it's not reimbursed or covered by your health insurance, but then you have to pay the cost. And we now have that data around what percentage of those costs are not covered, what percentage of those costs need to be reimbursed, and that's helping us drive healthcare decisions. We also have been able to do studies around the diagnostic odyssey. So how long does it take for someone with a rare disease to get a diagnosis? What are the avoidable elements of that diagnostic odyssey? And then we've been able to pair costs to that data. And so we have so much critical data now that we're able to work with policymakers, not just so they have that data, but that we can actually change those outcomes and change those policies. But now let's talk about that regulatory infrastructure and what happens in the regulatory environment, because I know that's incredibly important to this community. So this is something that's referred to as the cure to care continuum. And I think a lot of times we spend a lot of our time focusing on sort of this left-hand side. So when we go from a concept, an idea that would help change our health outcome to we get that first FDA approval. And we used to say it takes an average of 15 years and $1 billion. We now have updated data show it can take 15 years and up to $2 billion to get from that concept to an FDA approval. And we know that that's not a straight line. And I think that's something being experienced by this community right now. There's a lot of back and forth and churn in that time period. But the truth of the matter is we don't need to just get to the FDA approval. What we need to get to is we have to get medicines that work into our families, into our loved ones. And that's what happens there on the right-hand side. And then we need to learn from those experiences to be able to always be improving on those medicines and be improving on those interventions so that we have this learning healthcare system. So how do we do that? Well, it's really hard in rare. And there are a lot of disadvantages in rare because we're small patient populations. We often don't have a lot of natural history data. We don't have a lot of well-studied trajectories of disease, and they change. Clinical trials are very hard to conduct in our communities. As I already talked about, there are really a lot of delays to diagnosis, so that by the time somebody gets a diagnosis, we can't optimally understand what their path to that state actually was. And we're not, even if we are intervening, we're not doing it in a way that's going to optimize their outcomes. We've missed some of those ideal treatment windows for people. And there's so much regulatory uncertainty. And actually, this slide, I used this slide all last year, and you could actually circle that, highlight that now, put big bold stars around that, because that's actually intensified even recently. And we've already talked about those development timelines. So what that means, though, is that it makes rare the space that we need to have unique incentives and unique regulatory pathways. We have to mitigate for all of this. And that's what we do. The other thing that everyone in this room knows better than anyone in the world is that time is our most precious commodity. We don't have 15 years. We don't have 15 months. We've got to figure this out. So what we have done as a community is we have shifted this paradigm. And we have shifted this paradigm in a way that within this ecosystem, it puts patients and patient advocacy communities in the center. And it incentivizes the use of patient experience and has actually codified something in statute called patient experience data, so that patient experience and patient experience data is infused into every level of decision-making everywhere within this ecosystem. So a little bit more about what that looks like. So within every area of regulatory decision-making, there are often quandaries. So FDA is charged with protecting the broad public health. We want to move things faster. There are different levels of benefit risk trade-off and different risk thresholds that we will accept as communities. How does that get balanced? So what we have done as communities is we have worked to work within those regulatory frameworks, but we have worked to develop guidances to pull all of our partners together to say, what are the shared learnings in clinical trials that we can then share out so that we are learning in real time and can develop the field forward faster. We're updating and changing legislation. We're developing novel incentives for industry to be working in our spaces. We have legislative efforts underway right now, and that's what I'm going to spend the rest of our time talking about, that will forever shapeshift this environment. And many of those got into the end zone, if you will, previously, and right before we got to the point of passage, failed. But we have a really unique opportunity now to get them done. And so we really need to, as a community, come together and get these bills passed. And we can do it. We just need to be working together. So we're working on unique rare disease therapy development incentives, some of which existed previously but expired. We're working to de-risk investment in our space. These are rare therapies. Companies that are working in our space, first of all, often don't already have commercially approved therapies that they can be relying on the income from as they're working in our spaces. But then they're also working on rare therapies. Once they get into therapy approved in our space, they're not going to make the same amount of money they would if they were working on an Alzheimer's drug or arthritis indication. We have to have incentives for companies to be working in rare, to be able to stay in rare. And then we have to have regulatory frameworks that enable better consistency, predictability, and transparency. It is not okay for companies to have to be going broke while they're working through regulatory red tape. Okay, so I actually put this together last week when I knew I'd be coming here, because oftentimes I hear from people who really worry about what has the last year been like? What have patient advocacy organizations been able to do? What have we achieved? And so I just actually took our board report and just pulled out some updates on what we as a community have done in the last 12 months. And these are just some of the examples of what, when our community comes together, we can do to ensure that the rare disease community is on the map, is in front of leadership, and is moving the needle. And so while there have been a lot of shape-shifting events that have happened, while we have had some significant losses, we've had a lot of people within federal agencies who we counted on who are no longer there. We've also had some gains. We've made sure that the rare disease community remains in the forefront of the minds of our leadership. We have made sure that as we've had new leaders coming in, some of the first groups they've met were us. We've had record numbers of members of the rare disease community coming to the Hill and meeting with newly elected directors of NIH and FDA. We've had our priorities in front of the new administration over and over and over again. And then in large packages and large bills, we've had some gains. We've actually been able to make corrections to what happened in the IRA for our rare disease community. So we've been able to really make some significant gains, but we have a lot more work to do. So while we've had some rainy days, we have had some gains. So here's what I'm going to talk about some of the more work to do. And these slides will be made available to you. So there's a lot to read here, I realize. Okay, if you're like me, there's so much you want to get done. And it's really hard sometimes to prioritize what is it that I'm going to lean into. We also have families that we're taking care of and full-time jobs, and to even figure out where am I going to spend the time making a phone call about something, which issue am I going to worry about? So here's how I'm just going to break this down. If you're concerned about your healthcare coverage, one of the biggest, most pressing topics right now is what is going to happen with Medicaid, as some of what just came out of the bill that was passed just a few weeks ago gets implemented in the coming months. So Medicaid eligibility is very vulnerable. And in our rare disease community, we are a 50% Medicaid eligible community because so many individuals in our community are eligible for Medicaid, especially because of waiver eligibility. So if that matters to you, there are a lot of opportunities to advocate and be engaged in Medicaid advocacy. If you're concerned about therapy development and you're really leaning into what's happening right now with some of the therapy development pipelines in the community, there are a couple key issues, one of which is the Pediatric Priority Review Voucher reauthorization, which I'll talk a little bit more in a second. And the other is just the overall levels of funding for biomedical and federal research funding. These are all issues that we as an organization are leading a lot of efforts on. We're pushing out action alerts on. The MPS Society has been a very strong partner on. I see Hunter's Hope out here. These are organizations that have been leading with us, and there are opportunities for activation. If you are committed to eliminating avoidable diagnostic delays, newborn screening is an incredibly important area for advocacy and activation. And Amy's going to talk a lot about that in just a moment. But the Newborn Screening Saves Lives Act has expired and is being reintroduced. And there are going to be key opportunities for activation around the Newborn Screening Saves Lives Act this fall. So if that's an area that's important to you, there are going to be really important opportunities for engagement there. And if you just want to know how to get involved in all of it, how to be a more active patient representative, how to serve maybe on federal advisory committees as opportunities are coming up. We actually run courses on that, and you can find out more about that on our website. And at the end, I have information on how to reach out to me. And we have a training program called Rare Advocacy Learning, and one that's specifically for young adults called our YAR Leadership Academy. Okay, I see that my time's running out, so I'm just going to go very quick through this next part. Healthcare coverage. Medicaid is not done. There are a lot of opportunities to advocate for Medicaid. Those opportunities are at the federal and the state level. But I will tell you, if you are eligible for Medicaid through a waiver program, that as states are going to have to make hard budget choices, their Medicaid waiver programs are going to become vulnerable. We are really doubling down on our advocacy efforts around Medicaid. And if this is something that you are interested in joining us with, we invite you to join us. We have a very large Medicaid campaign. Hopefully you saw and maybe participated in our I Am Medicaid campaign. And we are now pushing that out into our state advocacy efforts. I am pleased to say that a lot of the advocacy we did made it to the Hill when they were voting on HR 1. While that vote didn't go the way we needed it to as a community, many of our rare disease community members' photos showed up on the Hill. Advocacy matters. The PRV, the Pediatric Priority Review Voucher, is one of the most important incentives we have in our toolbox of incentives for rare disease therapeutic development. Again, I will share these slides later, but I'm here to tell you we must get this reauthorized. We thought we had it done. We thought we were going to get this done in December. It expired in September, and the bill that we hoped would pass in December did not. We have a window of opportunity to get this done this fall. We think we could with a big push from the full community. This is a very important way to get de-risk investment in rare disease for companies to work in rare. We will share these slides, and maybe I'll work with Sharon for your advocacy days in October to talk more about this. But here's what I'll show. More than 50 rare disease therapies have been approved that otherwise would not have been approved because of this incentive. We need to make sure that this is reauthorized. We can get it done together. The Creating Hope Act is the name of the legislation, has more than 200 co-sponsors in Washington. We can get this done. And last but not least, newborn screening. Our newborn screening system has taken a lot of hits. It's pretty vulnerable right now, but we also have a lot of champions in Washington. Amy's going to talk a lot about the importance of this program. We are working with a broad coalition, and we have a lot of coalition members in this room who've been working with us on the reintroduction of the Newborn Screening Saves Lives Act, which is the broad legislation that overarches our federal newborn screening system and helps drive how funding is spent and how both the federal and state newborn screening system is driven in the US. It is expired. We must get this reintroduced. Okay, all of these resources that I've talked about are on our website, so I know I went through a lot really quickly. We also have guides for individuals who are interested in being more engaged in therapeutic development. You can find all that on our website. And if you know any superstars in the rare disease community who've been involved in advocacy, we right now have a call open for our Rare Voice Awards, so that's a plug for that program. And please stay connected. This is how you can reach out to me, especially if you're interested in anything more specific than what I talked about. All right, thank you.
All right, thank you so much, Annie.